Hi everyone, I am Dr. K. Naveen Krishna, consultant intervention cardiologist from Star Hospitals, Hyderabad. I wish everyone World Heart Day, good healthy heart for everyone. So it is customary for us cardiologists to give a healthy heart message on this World Heart Day. Today our objective is to discuss about and understand about heart attack. I'll be discussing about what is heart attack and what are the causes for heart attack, how we will diagnose the heart attack, and what we should do, and how can we prevent the heart attacks. So coming to the heart attack definition, basically heart is a muscular organ in body which works 24 hours a day and whole year. So the heart requires nutrition. That is the blood which gives the nutrition to the heart are called as coronary arteries. Any blockage in the coronary arteries for seconds would cause heart attack. So blockage of the coronary artery is called as the heart attack. So the heart attacks present to us with symptoms of chest pain, like heaviness in the chest, which is especially in the center, which can radiate to the left arm, or it can be associated with pain in both shoulders, or it can radiate to the neck, and sometimes it may even present as only a jaw discomfort. And sometimes the pain will radiate to the back. And sometimes in elderly patients, it will be atypical, like only epigastric burning sensation, or it can be merely a right-sided pain also. So strong clinical suspicion should be there when you have a unusual chest pain, which is not related to any of your exertional activities. And if chest pain is associated with other symptoms like breathing difficulty or associated with sweatings, unprovoked profuse sweating also should enlighten us, and you should get yourself checked up. And especially in a diabetic patient, sometimes diabetic and elderly patients, they might not have chest pain always, especially these are called as silent heart attacks. And the other most important thing which we have to understand about heart attack is the causes of heart attack. If you see, the most common causes are the high blood pressure, that is hypertension, and high sugars, that is the diabetes. So these both contribute to almost 2/3 of the causes of heart attack. Along with this comes the like bad habits like smoking, alcohol. These also enhance the risk of having heart attacks. And one more most commonly noticed nowadays is the stress component. So we are seeing nowadays heart attack even in the young. This is because of increased stress and changed lifestyle patterns with more sedentariness, decreased physical activity, which are leading to more uh, uh, complications like hypertension, diabetes, and obesity. These are leading to increased incidence of heart attacks. Then next comes the diagnosing the heart attack. So once you have these symptoms of heart attack, it is important that you recognize it at the earliest point and seek a medical help immediately. So if the patient, if the person is already known case of heart disease, he can recognize the symptoms and immediately take a sorbitrate and ecosprin. For a layman, it is probably best to have disprin or ecosprin by hand, especially more than 45 or 50 years of age. It's better to keep a tablet of disprin at home. It will be both helpful for your body pains, and in a cardiac emergency, it is very much helpful drug. So initially, if you take this tablet, the blood thinness will start from that point. So ecosprin is the drug which we recommend to be taken even at earliest point. And then the second part is going to the nearby hospital or a diagnostic center getting yourself checked up by doing at least a minimum basic ECG. The electrocardiogram will reveal the heart attack nature, a minor heart attack or a major heart attack, or no ECG changes. Sometimes it is like the initial, when you had chest pain, immediately if you go, the ECG changes might not be there. At that time, you should be cautious. If the symptoms are persistent, it is better for you to repeat again the ECG after an hour or 2 hours. And then it is important to evaluate further in the form of a 2D echocardiogram, which will show the heart pumping and blood enzymes, that is cardiac enzymes, which will show the nature of the heart event, whether it's a mild event which is negligible or a major event. So the troponins, the cardiac troponins are raised, it means that it's a major cardiac event. So we should be aware of the symptomatology and of heart attack and know how to diagnose it and start our treatment immediately. So the main part which comes in the way is ignorance of the symptoms, which will lead to delay in the diagnosis and treatment. That will be lethal. Why? Because it can either end up in having a sudden cardiac death later, or sometimes like neglecting the symptoms will later on, it will present with a severe weakness of the heart, which will go into heart failure later. So it is very important not to neglect these symptoms which I have told you and take care of yourself. And the final thing is the prevention. Always the most important thing is prevention is better than cure. This proverb stands good always. We should take measures right from our childhood times. So we should encourage our children having healthy habits, like considering both diet and exercise. Diet wise, healthy heart diet means taking more fruits and vegetables, reducing the intake of saturated foods. Those are like fast foods, burgers, pizzas, or cool drinks. You have to reduce those things and increase your intake of fiber, fruits, and vegetables. And the second most important thing is the exercise. Walking at least a half an hour a day, at least 5 days a week, is a minimum recommended from the World Health Organization. This will keep us healthy. Or you can do intensive exercise for at least 1 hour in a week. These all will help us to maintain our heart healthy. And the other things which are important are reducing our bad habits, like quitting smoking and reducing the alcohol intake. And the other most important thing is managing the stress. So we should always try to minimize our stress, plan some de-stressing exercise plan, or doing yoga or meditation, or having a vacation which will relieve our stress, or sharing your work with or your worries with your colleagues and getting encouragement is most important. So stay healthy and take care of yourself and your family members. I wish you a happy, healthy heart.